Come in.
Hi, my name is Abe. I'm going to go ahead and be your nurse for today. Could you please verify your name and date of birth, please?
Yeah, Matthew Fernandez, January 23rd, 1998.
Alright, are you allergic to anything?
No.
Alright, do you know where you're at?
Yeah, Baptist Hospital,
And the year?
2021.
Alright, awesome. We're going to go ahead now and begin your head to toe assessment. This is just a series of tests that I do, and I collect all the information and give it to your provider, okay?
Okay.
Alright, before we go ahead and begin, I just wanted to let you know that we already, previously we assessed your cranial nerve number 2 with the Snellen chart. The patient has 20/20 vision with corrective lenses, and also they also checked your vital signs. And from what I saw, they're all within normal ranges, okay?
Okay.
I'm going to go ahead now and just raise the bed, lower the bed rail so we can go ahead and begin, okay?
Okay.
Alright, so after I do that, could you go ahead and please sit at the edge of the bed?
Of course.
Okay? We're going to go ahead and start off by inspecting and palpating your head. Alright?
Okay.
So, while inspecting and palpating the head, I'm looking for any bumps, bruises, patches of hair, scarring, and from what I see, there's nothing here. Everything seems to be normal. Okay, I'm going to go ahead now and palpate your head. Let me know if you feel any discomfort, okay?
Okay.
Alright, do you feel any discomfort here,
No.
here,
No.
here,
No.
here?
No.
Okay, everything feels normal. Alright, now I'm going to go ahead and grab my pen light and check your pupils, okay?
Okay.
Alright, just look at my nose here. Okay, pupils seem to be reactive and normal to light. Now I'm going to go ahead and assess your cranial nerves 3, 4, and 6. And how I do it is just go ahead and look at this tip of this light, and I'm going to go ahead and move it in different spots, and your eyes just follow. Okay.
Okay.
All right. All right. Ocular motor nerve seems to be functioning properly. All right, now I'm gonna go ahead and look at your ears. Before I do you use any hearing aids?
No.
Okay, I'm gonna go ahead and inspect the ears. Tympanic membrane looks fairly gray. We would typically check this with an otoscope. All right, I'm gonna go ahead and whisper something to you and just repeat to me what I say.
Okay. Yellow bus. Red car.
Okay, great. Now I'm gonna go ahead and check your equilibrium. Okay, so you please just stand up for me.
Of course.
All right, look forward, and then just close your eyes. Okay, patient, there is no swaying, so that means that you don't have any balance issues. Could you go ahead and please walk for me and then walk back?
Of course.
All right, no issues walking. All right, you can go ahead and sit down. Okay, I'm gonna go ahead and inspect your nose now, okay?
Okay.
Okay, look up for me, please. Okay, I don't see any obstruction in the nostrils. Could you go ahead and just close one nostril and inhale? Okay, do the same thing with the other. Okay, great. I'm gonna go ahead and give you a sample. Just let me know what it smells like.
Okay. It smells like coffee.
Okay, great. All right, now could you go ahead and look up for me and swallow? Okay, could you go ahead and look down again? Smile, please. Okay, open your mouth. Go ahead and stick your tongue out, and then go ahead and move your tongue from side to side. Okay, now for the final cranial nerve, could you please go ahead and shrug your shoulders against my resistance?
Yes.
Okay, awesome. Now, after all cranial nerves have been assessed, before I continue, can you please just clench your cheeks? Okay, good. All right, now that we've officially completed and assessed all cranial nerves, I'm going to go ahead and move on to assessing your neck. So if you can go ahead, please look that way. Okay, look over there. All right, there are no signs of JVD. I'm going to go ahead and palpate your lymph nodes. Okay, everything seems to be in normal functions with the lymph nodes. Okay, I'm going to go ahead and palpate now your thyroid gland. Okay, now I'm going to go ahead and palpate for your carotid artery. On the other side. Okay, now I'm going to go ahead and auscultate the carotid artery. Okay, everything seems to be normal there. And before I go ahead and continue, I just want to state that there are no lesion scars or any kind of bruising on the neck. The skin looks intact. Okay, now I'm going to go ahead and move on to your arms, upper extremities. Everything looks normal, no skin breakdown, no bruises, bumps, or any kind of skin issues. I'm going to go ahead and just check your temperature. It feels warm to touch. Could you go ahead and lift your arms up and out, please?
Sure.
Okay, range of motion seems to be just fine. All right, I'm gonna go ahead now and inspect for palpate for edema. No edema. Okay, no swelling. All right, there's no clubbing of the fingers. I'm gonna go ahead and check for radial and brachial pulses simultaneously. And then could you please just extend your fingers and like this? All right. I'm gonna go ahead and check for capillary refills, and it seems to be that there is a brisk return in the capillary refills. All right, you can go ahead and put your hands down. All right, now I'm gonna go ahead and continue by. Now we're gonna go ahead and move on to the chest and the heart. Okay.
Okay.
All right. So for this assessment, we need the patient's chest exposed, but for the sake of the video, we'll not be doing that. But the patient's chest, there's no skin breakdown. Everything looks normal. Symmetry is even. And there's no pigeon chest, anything like that. So now I'm gonna go ahead and just auscultate your heart sounds. Okay.
Okay.
Okay, heart sounds sound normal. Okay. All right, now we're gonna go ahead and move on to the pulmonary sounds in your back. So if you can go ahead and please just sit at the edge of the bed right there, which is a little easier. Okay, for this assessment, we would expose the patient's back. I'm assessing the spine. It looks linear, even on both sides. There's no skin breakdown, no bruises, bumps, or any of the sort. No signs of scoliosis or kyphosis. Spine looks normal. All right, now I'm gonna go ahead and just auscultate your lung sounds. All right.
Okay.
Okay, lung sounds sound normal. Now if you can just go ahead and return to the bed and lay down, please. All right. Actually, sorry. I apologize, but if you could please just stand up again.
No problem.
All right, and just sit down. All right. Can you go ahead and grip my fingers as hard as you can? All right. Now can you go ahead and let go, please? Push in against my resistance, and now put your hands inside and push out. All right. Great. Now I'm gonna go ahead and just get my hammer here. 1 second. Okay, sorry about that. All right, now you can go ahead and just lift your arm like this. Can you feel that?
Yes.
Okay. Okay. Reflexes seem normal. And I'm gonna go ahead and do it on your leg as well. Okay.
Okay.
Okay. Okay. All right, reflexes are normal. Could you go ahead, please? And before I get laying down, could you go ahead and do this real quick for me?
Sure.
All right, and now could you go ahead and bring your left leg up to your right shin like this? All right, great. And now could you go ahead and do it with the other leg? Awesome. Cerebral movement is functional. Please lay down. All right, now I'm going to go ahead and just inspect the abdomen. Abdomen looks normal. There is no distension. It's not inflated, bloated, anything like that. Now I'm going to go ahead and just auscultate the abdomen in 4 quadrants. Okay, bowel sounds sound normal. Now I'm going to go ahead and just percuss the abdomen. Okay, percussion sounds on the abdomen sound normal. There is no signs of some kind of mass or any dullness sound that would raise any awareness. Okay, after that, I'm going to go ahead and palpate your abdomen. Let me know if you feel any discomfort, okay?
Okay.
Feel anything?
No. 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 No.
Okay, great, awesome. Now I'm going to go ahead and move on to the lower extremities, where I'm going to go ahead and begin just by inspecting the legs. They look just fine. No skin breakdown, bruises, bumps, or anything of the sort. No patches of hair or anything that has any concern with the skin. Could you go ahead and just Lift your legs up, raise your knees like this for me.
Sure.
Okay, now put them back down. Alright, range of motion seems to be fully functional. I'm going to go ahead and just check for edema. Okay, there seems to be no kind of edema. I'm going to go ahead now and just palpate for the pulses simultaneously. Okay, and now I'm going to go ahead and just check for the capillary fluid dose. Okay, Matthew, it seems like I'm just about done. Before I go ahead and finish and wrap up, I just want to ask you: have you ever had thoughts of hurting yourself or others?
No.
And do you feel safe here or at home, or both?
Both.
Okay, sounds good. I'm just about done. You can go ahead and I'm gonna go ahead now and just raise the bed rail again, and then raise the bed as well. And just let me know anything else that you need. But for now, I am done. Just get yourself as comfy as you can, and the provider will be with you shortly. Okay?
Thank you. Have a great day.
You too, man. Thank you.